Hey everyone, and welcome to another episode of the Onruns podcast. My name is Lauri Bruna.
And I'm Valeria Sola,
Today we have a special guest.
the orthopedic surgeon Dr. Christopher Alcalá.
To start off, how are you feeling today?
Very good. How about you guys?
Good.
Great.
We have a set of questions that we wanted to ask in order to know you better and for the benefit of our audience. So, to start off, what motivated you to study medicine?
Well, to study medicine, the first thing you need is passion. So, what better calling than helping someone else, either alleviate their pain or helping them out with a condition where we actually are always treating people that are afraid, especially not only in pain, but if they have a condition that they don't understand, it's their body. And like we always say, health is number one. So I think there's no other more divine calling than becoming a doctor.
Now, we have many people spend a lot of time wondering how they will choose their specialty. So, how did you know that this specialty was the right one for you and what helped you through that process?
So within orthopedics, what I specialize in spine surgery. So I did that because both my dad and my father, rest in peace, both had spine surgery. So I kind of was involved and exposed to this field early on in my life, especially at 5 years old. My dad had an issue where he couldn't walk for a better part of a year, needed surgery. So I think that shapes the way you decide what to do for a living and also shapes your passions.
In the field of medicine, there are so many sacrifices that come within it. What do you consider has been the greatest challenge in your career and how did you overcome it?
Well, I don't see it as challenges. I see them as steps in life, especially in your professional career. Uh, Everything that is worth doing in life always comes with a challenge. It doesn't mean you are gonna say, "All right, this is a challenge. I think it's too tough," or "Can I do it or not?" I think the like I always told my students, fellows, when I was in the United States for a few years, this is a marathon. It's not a 100-yard dash. So having that way of thinking when you're doing any type of subspecialty medicine, I think it's vital. I think you don't have to rush into this. You have to enjoy every single moment of your career. And if there are always going to be challenges, it's a long career. But at the end of the day, I can tell everyone it's completely worth it.
I cannot imagine how demanding your days are. What does a typical day at work look like for you?
Well, like today, we saw here many patients. You were, nice enough to come later in the day, but you guys always have your doors open here. But I have many hats in what I do, not only here in my practice, which I serve as vice president. I'm also the president of the Orthopedic Society and the surgeon in chief for this hospital system. So there's many things if you want to push things forward in a country or in a specific healthcare or health career. There are many things that you have to do, right? And I think organization is vital for this. So I think you can do many things. I'm a father, I'm a husband. That is my number one priority. It's my number one job. I feel this is a hobby. That's why when you decide what to do in medicine, it needs to be a passion. But usual day, I've always been an early riser, so all doctors need to be real early risers. And so I wake up usually around 5:30. Already, I'm here in the hospital at 6:45. Depends if it's a surgery day or a clinic day, like today, an office day. There's some also things that I do apart from that, other meetings and whatnot. But a surgery day, we start surgery usually around 7:30. We're done when we're done. There's sometimes long surgeries, shorter surgeries. We're not in a rush, so we can usually we stop around 4 or 5 p.m. So today we're here. So usually that's an usual day. Sometimes it takes longer, but I enjoy every day. So I don't see it as a stop on the clock. I always thinking about my family, number one. So if I have to go to a volleyball practice or a basketball practice, go out with my wife, those are the most important things too. So I think medicine is part of your life, and it's very extremely important for you to organize your day, right? You can do a lot of things, but organization is vital in what we do.
Many doctors say that patients always impact their way of thinking and acting towards other patients. Has there been a patient who changed the way you view medicine?
I think that impacting the way you you do your passion is very difficult. It's very difficult, right? So I think there are many patients that always touch your heart in special ways. I think many of mine, right? For me, doing my office is, well, it's a special experience all the time, right? You see them, see they're doing well. It's a very gratifying experience. So pinpointing a specific patient would be very difficult. In what we do, we deal with pain. So giving relief of pain to someone that came miserable, it's something that still this day and age, and I've been doing this for quite a while. I still love what I do. So specific patients, yeah, there are some cases that are like super difficult, challenging, things that are very dramatic. Like we do patients that sometimes come here in a wheelchair that they cannot even comb their own hair, take care of themselves, and they come walking. So seeing that through many years just keeps you pumped, and you come back and work every day and try to do everything special. So yeah, there are some patients that you can say, yeah, uh, it's a specific case that you, but these patients, when you do what I do, they become part of your family. So you take them to sleep, you come back and take them in your brain in the morning. So it's difficult to pinpoint one. I think all patients impact my life, each one of them, right? You treat them as family, and also I see them as such.
Medicine takes many mental challenges. What motivates you to keep going after long and exhausting days?
Well, I think days can be exhausting. I think you can have, as a spine surgeon, there's a degree of hyperactivity that you need to have, right, to keep on going during the days. Uh, you need to have a good culture where you work. And if you're in leadership positions, you have to push to make that culture as feasible as possible for everyone involved to enjoy where they go to work, right? So I think if you have a great culture, you love what you do, you're doing the right thing for patients. Uh, you can be sometimes physically and mentally exhausted, but you continue pushing on because it's the right thing to do.
Along with the challenges and battles, there are always achievements. What is the most rewarding part of being a doctor?
Helping people, relieving their pain, right? Becoming a friend, becoming their family. I don't think there's no higher calling than that.
Many students wonder how to give a positive impact as a doctor. What advice would you give to a student aspiring to make a real difference in their patient's life?
Caring, treating people like people. It's as easy
Mhm.
as that, right? I don't think it takes many classes to know that. That comes from within. Someone that it's noble, that wants to see their um, our neighbor doing well. That's the highest advice. If you're going to do into medicine, it needs to be your passion. You cannot do it because someone told you to do it, because it sounds cool to be called a doctor. No, it needs to be your passion. It needs to drive you. It needs to be a driver in your life.
Now, could you describe a moment when you realized that all your hard work was worth it?
Every day doing this, right? Taking care of you guys, telling the next generation it's really important to do such a profession like what I do, right? Uh, but every single day that I have any impact in someone's life, it's totally worth it.
To wrap things up, if you could summarize your professional experience in one lesson that every medical student should know, what would it be?
I would say choose your passion, chase it with courage, and hopefully one day it will become your profession.
Well, and with that, we have come to the end of today's episode. Dr. Alcalá, it has truly been an honor having you with us.
Thank you so much for taking the time out of your busy schedule to answer our questions and share your experiences with us and our listeners. Your insights have been incredibly valuable and inspiring.
And to our listeners, thank you for tuning in another episode of the On Rounds podcast. Stay curious, stay motivated, and we'll see you next time.